Okay, a few minutes on appendicitis, very few minutes. The appendix is way down at the bottom left near the cecum where the small intestines attach to the large intestines. It's just this blind pouch that really, we don't know what it does. We haven't been able to find that it does anything, but feces can get into this, but it has a hard time getting out. And if it gets trapped in there, it's going to harden. Fluid's going to be absorbed from that as well as the other areas. It becomes hardened because it doesn't go anywhere. The area eventually becomes inflamed and swollen. It can get gangrene, and it can perforate, causing peritonitis. And again, we're going to have inflammation of the abdomen, infection in the abdomen, and this is a life-threatening condition. Diverticular disease. There's a weakness in the intestinal wall that leads to these formation of these little pouches. It's associated with chronic constipation, and this chronic constipation is putting pressure on the walls of the colon, and it will eventually damage the walls, causing this weakness. Consequences, we're going to have decreased motility because the walls are weak. They're not going to, even on top of the pouches, the walls are weakened. We're going to get obstruction because stuff is going to get stuck in those pouches, and we're going to have impaired perfusion. This disease causes pain in the abdomen, fever, nausea, vomiting. And when we treat it, best thing to do is to prevent it, and we do that by preventing constipation. All the things we do to prevent constipation: high fiber diet, avoid foods that can cause constipation such as bananas and rice, avoid foods that can be retained in the diverticula such as nuts, seeds, and strawberries. Fluids, at least 2 liters a day of fluids intake. Lifestyle alterations such as increasing exercise. And then there are pharmacological things we can do, bulk forming laxatives and antispasmodic medications. When we treat this, if it exists, the disease exists and we can treat it, we can do it by managing the symptoms, directly addressing each of the symptoms, controlling infection, bowel rest. That may be done by eating very bland foods that are easy to digest. It may be done through surgical correction. Sometimes we're looking at a temporary colostomy to let the bowels rest. And we're looking to prevent complications.